Hey, and did you know I'm currently accepting new patients in New York, offering both in person and telehealth visits? And I also provide telehealth for patients in Michigan, with North Carolina coming soon. And I also offer coaching, both intimacy coaching and menopause coaching, nationally and internationally. So look us up on www.femvhealth.com. I am an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf, and this episode is everything you need to know about midlife and menopause and weight management and all that great stuff. But before I get into it, the first thing I want to make very clear is this is not any type of medical advice. So if you have any questions about your health, make sure you go speak with your healthcare provider. And of course, as always, if you have any questions about your religion, make sure you go speak with your friendly neighborhood religious leader. This is a Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So Dr. Traci DeSplinter, I'm so excited to have you on. For all those people that may not know you, if you could please introduce yourself.
Yes, thank you for having me, Dr. Sadaf. I'm Dr. Traci DeSplinter. I am in Houston, Texas, and I serve the women of Texas. My practice, I am an OBGYN physician, board certified. I'm also certified in obesity medicine and in menopause care by the Menopause Society. So I
All
serve women
right.
in midlife throughout the state of Texas.
Amazing. And you are much needed in Texas because there are not enough OBGYNs. No offense, but that state is crazy for what it does to women and what it makes them do just to get health care. I don't know
Yes,
if you agree, but
we
they're
absolutely
crazy.
agree. Absolutely
They're
agree.
nuts.
We're in some very challenging times in women's health.
Yeah. Yeah, absolutely. Those women are dying and they become reproductive refugees and, they let them hemorrhage. I mean, it's just, anyways, I'm not going to get into that. That's not what this episode is about, but it does make me very upset. So you are an angel for being out there and helping out so many women that need help. So you spent decades in traditional OBGYN before transitioning into a more personalized model of care. Looks like you too are doing concierge now, which is awesome. What do you think broke your heart enough about the healthcare system that you decided to change?
Well, I practiced in the area for about 20 years. I've been a board certified OBGYN for 25 years. So all of my practice up to until this year was in the traditional insurance-based healthcare system, large hospital systems. Throughout the time that I was there, I was, of course, just like everyone else in that system, forced to see patients in very short appointment times. So when we're seeing a patient every 15 minutes, what that amounts to in reality is only about 5 to 7 minutes with each patient, because you have time to check the patient in, let her use the restroom, get her vitals, update her medical history, before you can even begin to start listening to her current concerns, talking about all the screenings that need to happen, answering her questions, developing a plan for evaluation of her concerns, and then talking about treatment options, sending prescriptions, and writing your note. All that has to happen in 15 minutes. So for years, I spent 5 to 7 minute increments with my patients and just ran around from room to room putting out fires. I think what really tipped me over the edge and broke my heart the most is when my established patients started telling me that when they called for an appointment, it was 7 months before they could get in. So they would have a concern or a problem. There were people I'd seen for 15 or 20 years, and they could not access me. 7 month wait. And at that point, I decided it was embarrassing. It was appalling. I felt like it was not the way women should be treated, and I needed to find a better way.
Yeah, yeah, absolutely. I mean, and I know that, right? Like 5 to 10 minutes. I mean, it's just not enough time. And you know what? For our pregnant patients, right? It's even less. Like you literally take a listen to the heartbeat, measure the fundus, right? And then they're like in and out. And you're just like, okay, baby, moving, any bleeding, any gush of fluid. Okay, no. All right, see you, bye.
Yes, and
Right? It's
pregnancies
crazy.
pregnancies these days, along with metabolic health in general, are just becoming less and less healthy. It's very rare that you would truly
Correct.
see just a routine OB patient who you only needed to do those things. You needed to do those things plus address growth issues with the baby, hypertension, diabetes, lots of complications in pregnancies that really it's challenging to fit into that 15-minute visit.
100%. So you talk a lot about health span optimization. What does that mean for women listening who are exhausted, overwhelmed, and not feeling like themselves?
So health span, I'm not sure if it's in the dictionary yet, but it's a newer term. I think it helps in understanding it to contrast it with lifespan. Lifespan is just the number of years that a person lives. I think that what's more important than making our lifespan longer is to preserve our health span, which is the length of time and the number of years that we actually feel well and can be free of chronic diseases and can really enjoy life and be healthy enough to do the things that bring us joy.
Yeah, absolutely. I mean, I think, people are talking about health span, people are talking about sex span, and I think that that's really important, right? We need to optimize our health while we still have it and before we lose it. So, why do you think so many women feel dismissed during perimenopause and menopause? I mean, sure, both of us can answer that, but yeah, what do you think?
I think it's a combination of what we've already talked about. The 5-minute visit, 5 to 7 minutes with your doctor is not sufficient to really discuss all of the symptoms and problems and questions that come up, much less to provide women any education on things that they may not even know are related to perimenopause and menopause. That combined with a lack of education in our healthcare system for doctors and clinicians.
Yeah, 100%. And, so many of our doctors, right? I mean, both you and I had to get educated on perimenopause, menopause, and all of that, take the certifying exam. I mean, so many doctors are not well versed on this and so don't really feel like they can adequately answer questions, right?
Yes.
So, what are some of the labs that, sometimes can be normal, but, people still feel horrible?
So really, all of your basic labs that would typically be checked in a wellness kind of panel could be totally normal and you still feel terrible. So not everything is captured in labs. Hormonal labs, for example, those levels fluctuate wildly, especially during perimenopause. But even before perimenopause, at different times in the cycle, the hormone levels will be various different ranges. So during the period or leading up to the period, the estrogen and progesterone can fall really low. During the mid-cycle, FSH and LH go high. So when you're measuring labs, it's kind of a snapshot in time, especially hormonal labs, and you may not capture the essence of why someone is feeling terrible, but that doesn't mean that they're not feeling terrible. You still have to believe them.
Yeah, 100%. So, how does menopause impact sexuality and relationships in ways people don't openly discuss, you think?
I think that it has a huge effect on lots of aspects of sexuality and relationships. With relationships, a lot of times they're affected by mood changes, irritability, anxiety. Sleep deprivation affects everyone's mood and the way we interact with others. That's a big part of perimenopause and sometimes even into menopause. And then sexual things can also be affected by mood and by the irritability that I just mentioned, and the way that you interact with your partner. There are also physical changes in the body that can affect sexual function.
Yeah. Yeah. I mean, sometimes, like women, I think that sometimes it can become really sensitive to the habits of their partner, right? So, even like, for example, the way they chew could be very irritating to a person,
Well,
right? Like,
that does
or if
often
they're,
become a thing in midlife. Yes, your breathing gets
yeah,
on my nerves. Hmm.
yeah, or like the way they, do certain things and all of a sudden everything is like irritating, it's crazy. So what do you think is the connection between hormones, sleep, anxiety, brain fog, libido, all of those things that get messed up in midlife?
I think that those are all deeply interconnected. So hormones have there are hormone receptors in the mood and cognition areas of our brain. There's the lack of sleep can affect everything in your body. So chronic sleep deprivation affects the way you function in every way, including sexually and how you interact with your partner. So I think all of those things are deeply interconnected. I think it starts with hormonal changes and then it just can kind of snowball from there.
Yeah. What do you wish woman would realize before they went into menopause?
I think that it's actually, we see it as a time of gloom and doom when we first start thinking about it or you bring up the word. That's the connotation of menopause. But it's what I wish people knew is that it's actually a very emotionally freeing time. So you don't have to have concern about an unwanted pregnancy. Um, Most women report once they kind of master their symptoms of menopause and are feeling better, they report that they have less worry about the opinions of others. So sometimes this allows them to really thrive in their professional lives, and sometimes it helps their personal relationships to grow as well. I also wish that women knew that it's a window of opportunity for preserving future health.
100%. I say that actually, and I was writing a paper, and maybe I need to finish it up. But I was writing this paper about how, we as OBGYNs say that pregnancy is a window into the woman's future, right? I
Yes,
often feel like, what about those women that never had children? And so I really think that midlife is also an opportunity to look into the future of a woman. And so if she
definitely.
starts to develop high blood pressure, if she starts to develop diabetes, heart disease, increased cholesterol, all of those things, right? Midlife is really the time to take ownership and change that trajectory of chronic disease. So I think it's really important.
Completely agree with you there.
Yeah. So, why do you think vaginal dryness and painful sex are so under discussed?
I think that a lot of women are unaware that this is basically universal after menopause. At some point after menopause, almost all women feel this. If they're left untreated, they have vaginal dryness and painful sex eventually. I think they may feel alone, not knowing that it affects everybody. And they may be embarrassed to discuss it with family members, friends, doctors. It can be culturally something that's kind of taboo to talk about openly. They may also be unaware of how easily this is treated and how it can be reversed with topical vaginal hormones that are safe for almost every single woman.
Yeah, I think that I think you brought up a good point is that there's still a lot of shame and taboo. And I think that because we work in medicine, right? So that
Yes.
kind of takes away the shame for us. And then I think that because, we focus on sexual medicine again, that shame and taboo, perhaps it was there. I don't know, at some point. I know for me it was there at some point, but now it's not there anymore.
Yes.
Um, that now we feel more comfortable, but I think a lot of people are not there yet, right? Like I think that a lot of people still have that shame, that stigma, that taboo, that talking about sexual health is wrong and it's not something that you discuss, and people feel very uncomfortable discussing sex. I just had a patient yesterday. I was talking to her about libido, and she was telling me that she was having painful sex, and I told her, she has vaginismus, and then I told her she needed to see a sex therapist, and she told me, well, I don't want to talk about sex with another person. And I said, yes, but you need it, because you have vaginismus, and vaginismus is a three-pronged approach. You need a pelvic floor therapist, you need a sex med doc, and you need a sex therapist to kind of help you with, changing your thoughts about this, and that it's going to be painful every time you have some type of penetration, right? So
Yes.
but she felt very uncomfortable discussing sex with anyone at all, even though she really needed the help, and it's affecting her relationship with her partner. But, she just, for her, it was very, uncomfortable, and she just didn't want to do it.
Yeah, definitely sad to hear that we're still encountering women like this and who have these taboos that make it prohibitive for them to discuss the things that would help them to get better. It is a biopsychosocial model of treatment, and I agree with you that all three of those prongs need to be involved in the treatment plan.
Yeah, definitely. So, how can couples maintain intimacy during this midlife transitions?
I think open communication is the foundation. Patience with the woman, having patience with herself, and the partner being patient as well, and certainly seeking help from a menopause specialist for the physical aspects that lead to pain with sex, and also maybe to help with libido if that's an issue. These are things that we can help with.
Yeah, 100%. And, I think that oftentimes it's a matter of visibility, right? Like people just don't know we exist. And so I think that once they know we exist and we treat all of these things, then they know that they can get the help. But oftentimes I feel like, sometimes patients just don't know that there are solutions for these common problems. So, what do
Yes.
you think partners often misunderstand about menopause and sexuality?
Well, what I hear from my patients, especially when they're suffering with low libido or new onset pain with sex, is that their partner often feels like they are not attracted to them anymore, or that they don't like them or
100%
love them anymore,
all
and
the time.
then that adds a whole nother dimension to the problem.
Totally.
I hear that really commonly from my patients who are still very much in love with their partners and attracted to them. They're just suffering hormonal changes that make it difficult for them to express their love and affection in the same way that they did in the past.
100%. And I see that all the time too. I mean, I know so many women come to me for, and I'm sure also to you for painful sex, right? And
Yes.
they say the same thing that, they want to have sex, but even just the thought of it is really, I don't want to say repulsive, but just, really makes them uninterested because of the pain that they're having. And
Yes.
that pain has not gone away, or, they have all this vaginal dryness, or because of the years that they've had vaginal dryness, now they have the vaginismus, the tightening of those muscles. And because of all of this that they've been going through for so long, it's created this pattern where now they are completely sex averse, right? Like they just don't want anything to do with sex. And so they're afraid to even give their partners a hug or a kiss because they're afraid it's going to lead to sex. And if it leads to sex, it's going to lead to pain. And then they're going to be in pain. And then they're going to be miserable. And so they just don't even, come near their partners anymore. And then their partners become like roommates, right? And so you don't really interact with them sexually anymore. And some people are fine with that, right? Some people, not everyone needs to be sexual if they don't want to be sexual, but for some people, it really does impact their life.
Yes, I agree with you. I see the exact same pattern in my own patients.
Yeah. So, why do you think pleasure is still so stigmatized in medicine?
I think it goes back to that culture of shame that you mentioned, and lack of knowledge amongst clinicians on how to help with these issues and how to bring them up and create a safe space to talk. I think it all goes back to shame and to a lack of education in this area of human biology.
I agree. And I think sometimes, like, the thought or the idea of pleasure seems selfish, right? Like, people are doing it for themselves, and they need to realize that they are a being that deserves to experience pleasure, right? It's not supposed to be, sex is not supposed to be painful. And so if it is painful, it's really important to get that resolved. So let's talk a little bit about metabolic health and prevention. So I know that you are a board certified in obesity medicine. And so, what is a relationship between menopause and metabolic health?
So those are deeply interconnected as well. What made me seek out the education and certification in obesity medicine is that weight gain in midlife is almost universal amongst my patients. Like the vast majority of them struggle with their weight and or their body composition, and I wanted to be able to provide knowledgeable help for this aspect of care in midlife. I think with weight gain happens as we age, independent of hormonal changes, but then the hormonal changes of perimenopause and menopause kind of accelerate changes in weight or weight gain, and it promotes visceral fat deposition, which causes a lot of things. It causes a change in body composition. It makes us lose our waist that we may have always had. It also leads to some health hazards with chronic systemic inflammation. It increases the risk of diabetes, insulin resistance, fatty liver, coronary artery disease. So basically all of the chronic conditions that kind of take root in perimenopause, they're tied together with visceral fat deposition, and that's definitely linked to hormonal changes.
So, why should women think about cardiovascular disease, osteoporosis, and dementia prevention in perimenopause, not after?
This is something so important that I wish more women were aware of. These chronic diseases that steal our health and our joy and our ability to enjoy life, they're largely preventable. So if you act soon and you're working with a clinician who has time to actually talk to you about prevention and to assess some of these things, some of these conditions really, really take a foothold during perimenopause and then worsen progressively thereafter. But like I said, they are easily preventable by just taking a few steps and being aware during midlife.
Yeah, 100%, right? It's kind of like that window into the future, like we were talking about.
Yes.
So there's so much conversation around GLP-1s, and we know that there are so many that are coming down the pipeline. And, there's a lot of talk about them being anti-inflammatory and helping
Yes.
with metabolic
Yes.
health. What are women getting wrong about weight loss and metabolic health, you think?
I think that we naturally just try to do what we've always done to maintain a healthy weight and the shape and body composition that we have enjoyed in earlier years. And trying to do the same things that worked previously often results in undernourishing. Strict restriction of caloric intake can have detrimental effects on all of these chronic disease risks, and it just doesn't work in the same way that caloric restriction worked at younger ages before the hormonal changes.
Hmm. So what do you recommend to your patients?
So I recommend measuring the body composition analysis so that they have a baseline of what the things that we measure and focus on. We
What do
can
you measure it with? Do you have an in-body scan?
I have
What do
a
you
Sika in bioimpedance analysis. It's similar to InBody. It's just a different brand. I like it
Sure.
better than the InBody, but yes. So I measure that, and then we measure it over time. We repeat it every 3 to 6 months, depending on what a woman is, what her goals are. We can look to make sure that if she's losing weight, that she's losing mostly fat and not losing skeletal muscle. If she started a resistance training program to try to build skeletal muscle, we can assess that periodically over time to see if what she's doing is working, to kind of check are the interventions that she's employing, are they beneficial, and are they working for her in the way that she wants them to work. And it really gives us a roadmap. It provides a guide so that we know she's getting adequate protein intake, skeletal muscles either being at least preserved or built, and that fat mass is decreasing and visceral fat is decreasing.
So how do hormones influence inflammation, muscle mass, and long-term aging?
Well, estradiol, our predominant estrogen that the ovary makes before menopause, is an anti-inflammatory molecule in the body. So it reduces or keeps inflammation low. The loss of estradiol then promotes systemic inflammation, and that inflammation increases the risk of so many chronic diseases and of aging. We know that muscle mass naturally decreases over time unless we actively intervene, and that decrease of muscle mass accelerates after estradiol and other ovarian hormones are lost during perimenopause and menopause.
Hmm.
So it's all tied
Yeah.
together.
Yeah, absolutely, absolutely. That's why, resistance training and exercises and weights are so, so important.
Absolutely.
Um,
Absolutely.
so what lifestyle interventions do you think have the biggest impact on women in midlife? Like, if you were to say, "Do this one thing, it's gonna have the most bang for your buck," what do you think that would be?
I think it's a tie for me between two things. One would be protecting your sleep, having a really good sleep
Mm,
hygiene, and
yeah.
aiming for 7 to 9 hours of good quality sleep per night. And that is tied in order of importance, I think with exercise. Aerobic exercise, of course, but mostly at this stage of life, resistance training can make the biggest difference. So exercise and sleep, I think those are the foundations.
Yeah, 100%. So now you do concierge medicine, and so what type of freedoms does that give a physician? Like, what do you feel has changed for you?
The biggest change, I think, is that I feel empowered to give every woman the time and attention that she deserves. I'm accessible. I'm available when she needs me, either to see me in person or virtually, or just send me a message in the portal if she has a question. Um, I think that the transparency that direct care involves, I don't bill insurance at all for my services. So a patient knows exactly how much she's paying and when she's paying it, and there's no surprise bill that comes, months later, like in the traditional system.
Yeah, 100%. So, why do rushed visits fail women, you think, especially during menopause?
So the rushed visits are a huge problem. There's too little time to address her care in a comprehensive way. You're just putting out fires, like I said before, where you're addressing the most immediate, most pressing concern, and then the visit time is just woefully inadequate to discuss all of her symptoms, provide her recommendations for evaluation of those symptoms, talk about treatment options, ask her about other things that she may be experiencing that she doesn't associate with hormonal changes or midlife health. And prevention just falls by the wayside. So you're dealing with the number one most pressing symptom, and then there's not time for anything else, basically.
Yeah, I think that's the problem, right? Like if we were to go back to traditional medicine, you're really just putting out fires, right? It's not about preventative medicine. You just don't have the time. Like all you can do is really like, what are you here for today? How can I help you? And then you deal with that problem and that's it. And you have about like you were saying like 5 to 10 minutes and then you go to the next person and then oftentimes if you are in a big corporate practice, right? They double, triple book you because they're like, well, in case a patient doesn't show up, we don't want that slot to be empty. We don't want the doctor to actually sit down and breathe for a moment,
Go
right?
to
We
the
just want,
restroom.
right, correct. Or eat anything. We just want
Yes.
the doctor to keep working like a machine and, just keep
Yes.
going on and on. So, yeah, absolutely.
Just definitely, it's a hamster wheel that you just keep
Yeah.
running on.
Yeah, absolutely. So, a lot of women see midlife as a decline, but for some women, it's actually awakening. What have you seen?
I think I observe an initial decline where people are just not feeling well, not sleeping well, feeling irritable, anxious, having issues with relationships, difficulty focusing, so that affects their productivity at work. But after that initial decline, for a lot of women who seek care, I think that there's empowerment and there's strength and there's almost like a blossoming. It's kind of like puberty, actually. So, puberty, if you think about it, it's painful and difficult and confusing at the time when you're going through it, but then afterwards, there's kind of a blooming. And I think the same can be true after the hormonal changes of perimenopause and menopause for women who have good education around it and who are aware of what's happening and able to get relief of the symptoms that hold them back.
100%. I think that I agree with you. I think that so many women, right, initially when they come, they are no pun intended, but a hot mess, right? Because they've been suffering for so long. Whether it's with hot flashes or night sweats or sleepless nights, or they're just not feeling like themselves, or their joints ache, or they have the brain fog and they have this new onset anxiety and depression. All of those things start to happen, and then they just feel awful. But then once you're able to help them, whether it's with hormones or whatever other modalities, then I feel like they have that sense of calm again and they feel like themselves. And then when they have energy, if they're sleeping, they have the energy to go work out and take care of their kids and be more social and all of those things
Yes.
that really improves quality of life.
Yes, I agree with that 100%. I think that you can really see women come from a low place and start, having some menopause hormone therapy or other management of their symptoms if they're not candidates for hormone therapy. And then you can really see them starting to feel so much better and to be, like I said, empowered to be successful in their careers, improving their personal relationships. It's kind of a nice process to watch. It's rewarding.
Yeah, 100%. I love it. It's almost like a big reveal, right? Like a patient comes to you before and they're like, not doing well. And then like, maybe let's say a month or 2 months later, they come back and they've like completely, like you say, blossomed and they've, now they're changed and they're smiling and they're dressing up and they look happy and you're like, wow, what has happened? And they'll be like, oh, I started taking the hormones and I feel so great and I feel like I have my life back and there's just so much happier.
Yes.
So, why do you think so many women finally start prioritizing themselves in midlife for the first time?
I think that a lot of them have been super busy with every moment consumed taking care of other people, and work and home demands monopolize all of their time. And finally, they are forced to find a way to prioritize themselves. Sometimes it coincides with when kids are leaving home for college, and maybe they are afforded a few more hours each day for themselves. Sometimes it's just that they get to feeling so poorly that they have to stop what they're doing and focus on themselves in order to be able to function and to serve the other people that they want to serve.
Yeah, yeah, finally, right?
Yes.
So what role does confidence and self-worth play in sexual wellness?
I think confidence and self-worth is the absolute foundation of sexual wellness. Without confidence and self-worth, I don't think it's possible to have sexual wellness. So
A
those are
hundred percent.
critically
Yeah,
important.
I mean, so many, right? So much of self-worth, right? Do you feel like you're worthy of pleasure? Do you feel like you're worthy of a good relationship? Do you feel like you're worthy of a partner that actually pays attention to you, doesn't ignore you, won't treat you, uh, you know, poorly or treat you with disrespect, right? Do you feel worthy? And I think that when you have that positive self-esteem, when you start to feel good internally about yourself, then your self-worth is going to increase. And hopefully that will then help you to feel good about yourself in so many other ways that you will decide that, you are worthy of pleasure and of being happy. So, what do you think is the biggest menopause myth?
I think that the biggest myth that a lot of women struggle with about menopause is that decline is inevitable and that they will become invisible. When in actuality, it may be the most personally and professionally empowering time of their lives. But I think they go into it feeling that decline in their health and decline in their relationships and decline in their career and all of that just feels kind of inevitable, and it's really not.
Yeah, yeah. What do you think is one symptom that women are just so surprised is hormonally related?
I think that people are becoming more aware of the lesser known symptoms, but it always itchy ears comes to mind, palpitations, anxiety, aches and pains like tennis elbow or plantar fasciitis. Musculoskeletal pains can be related to loss of ovarian hormones, and I think that surprises people, and they're really happy when those things get better.
Yeah, I think that, yeah, itchy ears for sure. I think vertigo, I think, is one
Yes.
that people sometimes will get. I've had vertigo and I'm like, oh my God, where in the world? That's really so scary, right?
It's
When you,
scary and it's miserable. It's incapacitating, really.
yeah, yeah, right, absolutely. Is suffering through menopause normal? What do you think about that one?
I think suffering through menopause is the norm, but I don't think it's normal. It's not necessary and it's not normal. So there's
100%.
easy fixes, lots of help available. It needs to be personalized for each woman, but we can get you feeling back to yourself and feeling well again.
Totally, totally. And I agree with you. I like the way that you put that, right? That it is the norm, but it doesn't have to be normal. What do you think is the most underrated habit for healthy aging?
I'm going to go back to my tie again between sleep and exercise, especially strength training. So, sleep probably is the foundation for good health and for healthy aging. And it's easier said than done, but we really have to prioritize our sleep, prioritize sleep hygiene, and focusing on protecting those 7 to 9 hours per night, every night, as well as being aware of sleep disorders that often onset in women during midlife, like sleep apnea, periodic limb movement
Yes.
syndrome. These things are really common and very under-recognized. So that's a big part of the foundation of good health and healthy aging.
I was shocked to learn about sleep apnea and how common that is as we age. Like, what the heck? Even women,
Yes.
that are not like obese can have sleep apnea. I mean, it's kind of ridiculous. And then what I heard was that I was at a conference and they said that terzepatide actually helps with sleep obstructive sleep apnea. And I did
Yes.
not know that.
Yes, it has an FDA approved indication. Of course, that doesn't mean that employer plans are required to cover it or to have it on their formulary, but it definitely can help beyond just the weight loss. I think the weight loss with tirzepatide is a big part of what helps sleep apnea, but even beyond that, it can still help with sleep apnea. Can reverse it in some people.
Yeah, they say it's as good as a CPAP machine, which I think is fantastic. I had no idea. So, one thing every woman should ask her doctor, but usually doesn't. What do you think that is?
I think sexual health concerns. So problems
Oh,
with
totally.
libido, painful
Yeah.
sex, diminished or absent orgasm. A lot of women would never bring that up or even think that it's appropriate to bring up with your doctor.
Oh, and the doctor is well, should be the perfect person. But,
Yes.
we know that not a lot of doctors feel comfortable talking about those kind of things. And so then, patients can really notice, I feel like, they can tell when their physician is uncomfortable. And soon as they see that their doctor's uncomfortable, they're definitely not going to ask any other person that same question, any other physician or provider, right? Because they're going to be like, well, I asked this other person and they were so uncomfortable. I don't want to bring that up again. And unfortunately, that leads to more silence, right? If only more doctors felt more comfortable talking about sexual health, then they could help their patients. And we wouldn't see where even in gynecology, right? Or whatever, another doctor will say, just have a glass of wine, which
Mm,
doesn't help anyone, right? We
no.
hear that all the time, which is
Yes, we
so
do.
ridiculous. But, I have a patient right now who has a hard time orgasming. She said she's never had an orgasm in her life. She knows that she feels a sensation, but she's never actually had an orgasm. She doesn't know what it's like. And so, we're working on that, but it's really interesting because with orgasm, as with anything in sexual medicine, right? There's the anatomical component, there is the psychological component, right? Like her thoughts that she's never going to have one, she's never going to experience one, so why even bother, right? It's not worth it. And then, of course, we know that tight pelvic floor muscles can also impact a person having an orgasm, right? So all of those things combined, I mean, it really requires a full body approach when we deal with anything in sexual medicine. But I agree with you. I think most sexual health concerns, right? Patients feel like they can't ask their doctors.
I think part of the reason that we may feel uncomfortable as clinicians is that we don't have the
We
education
don't have the
to
training.
help the patient. So we may not be the patient may perceive it as discomfort about talking about the problem, and that's probably not it at all for most doctors, especially most OBGYNs. But where we're uncomfortable is with ourselves and what tools do we have to offer to help patients. I know I feel like I've let down some patients in the past myself.
Oh, totally. Of course, unless we get the training, unless we really put in the effort ourselves, right? There's no way we would feel comfortable talking about sex or orgasm or libido, desire, all of that stuff. Because if we don't have the training, we're not going to feel comfortable and we're definitely not going to approach those topics with our patients. What's one thing you think medicine still gets wrong about women? I mean, there's probably a gazillion things,
There
but
are lots of things, but
like just one.
one thing that comes to mind is the lack of research in women's health, the lack of funding for research, which results in us being treated as little men, which we're not. Our physiology is extremely different. So that comes to mind.
Yeah, of course. And there's so many things we don't know. But on the other hand, what gives you hope about the future of menopause care?
I think that menopause, the conversation about menopause being more mainstream, and menopause, they say menopause is having a moment, but I hope what it's having is a movement. I think just opening the conversation and awareness being raised publicly gives me the most hope.
Yeah, I agree. And so, if a woman out there who's listening feels invisible, exhausted, dismissed right now, what would you tell her?
I would tell her to seek out a menopause uh, educated doctor. You could start by looking at the Menopause Society's website. It doesn't guarantee that you're going to find a doctor who's a good fit for you and is comfortable discussing these things, but it does. Menopause certified clinicians have at least had the interest to take the initiative to get extra training. And that suggests to me that those may be a good place to start.
Yeah, yeah. So I looked up a fun fact. There are over 64 million women over the age of 50. Okay. So they don't necessarily have to be menopausal. They're just over the age of 50. And that I think the statistic said that there were about like 4,100 Menopause Society certified practitioners. That means that there is one Menopause Society certified practitioner for every about 30,000 women over the age of 50. Isn't that crazy?
It really is definitely
There's not that
crazy.
many. So, for those people out there listening, and if you know of any Menopause Society certified practitioners, both myself and Dr. DeSplinter are both Menopause Society certified, then you should definitely reach out because there are not that many of us, and definitely reach out to people that know how to help you. So, with that being said, where can listeners and viewers find you, learn more about Refined Women's Health? They're sitting there listening, thinking, "Wow, Dr. DeSplinter is so super awesome. How can I work with her?"
So I'm in the Houston, Texas area, in the Houston, Texas suburbs. I'm actually really close to Houston Intercontinental Airport. So I would love
Oh,
to
wow.
see anybody who wants to come to Houston in person. I also have virtual visits for women throughout Texas. I'm licensed currently just in Texas. My website is refinedwomenshealth.com. I also have a weekly newsletter with topics that are pertinent to midlife women's health, and you can sign up to receive that newsletter every Sunday at tracydesplintermd.com. I'm on social media, Facebook, Instagram, TikTok, Threads, all with the handle Traci DeSplinter MD.
Awesome. Well, we are done here. And thank you so much, Dr. DeSplinter, for coming on and sharing your knowledge and wisdom with us. And we are so thankful for that. And well, we are done here, and it's been real and really intimate. And remember, this is not meant to be any type of medical advice. If you have any questions about your health, your midlife health, then make sure you go speak with your healthcare provider. And until next time, this is the Muslim Sex Podcast. So thank you for listening to the podcast, and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So be sure that you share it with all your friends. And thanks for listening.